Hi everyone, my name is Tashana Calderon with OCHIN. I'm Executive Assistant to Jennifer Stoll, and I'll be moderating today, and I hope everyone has had a good morning so far. I just wanted to remind everyone that you are on mute, but if you'd like to ask a question, please be sure to type those in the chat box. We'll do our very best to answer the questions from the chat box during the call today. And we will also be collating the Q&As from today's call and make them available via the HCA website. Also, a copy of the presentation will be made available on the HCA website after the call today. And if you have any further questions, please email Jennifer Stoll at stolljay@ochin.org. And her email address will also be shown on the very last slide as well. And I'd like to turn this presentation over to Dr. Chris Chen. Thank you.
Hi, everyone. Thanks again for joining us today. My name is Christopher Chen. I am a medical director here at the Healthcare Authority. I am a hospitalist by clinical background, and here at the Healthcare Authority, focus on Medicaid, and looking forward to talking to you today about a little bit of the work that we've been doing to support our community in the time of the COVID-19 pandemic. Tashana reviewed some of the housekeeping items, and so looking at the agenda for our meeting today, just in case some of you are not familiar with what the Healthcare Authority does, I'll be providing a brief introduction to the Healthcare Authority. Jen Stoll, VP for Government Affairs at OCHIN, is going to tell us a little bit about OCHIN. I will provide some background as to the platform. Jared Simmer from Epic will describe what the product is and walk through a little bit of the workflow, and then we'll have ample time for a Q&A at the end. So next slide. So again, from the Washington State Healthcare Authority. The Healthcare Authority, if you're not familiar with us, we are the state's largest purchaser of healthcare. And so we purchase healthcare for more than 2 million Washington residents through a number of different programs, including Apple Health, our Medicaid program, which has, as of last month, at least about 1.8 million covered lives, the Public Employees Benefits Board, and the School Employees Benefits Board. We work closely with our partner agencies, including the Department of Health, the Department of Social and Health Services, and the Department of Children, Youth, and Families. And so just wanted to also call out that we are not the public health departments that are performing the testing that is or overseeing public health activities, but we work closely with our partner agencies. And so we are very much on the purchase and payment side of things. Jen, do you want to introduce OCHIN a little bit?
Sure, thank you. Tashana, could you go to the next slide? So for those of you who may not be familiar who we are, OCHIN's a national nonprofit health IT and research collaborative. We're based in Portland. We do a lot of work in Washington State, specifically around supporting underserved communities' access, technologies, workflows, and innovations to help them stay connected. And so we work with Seattle-King County and Cowlitz County and many of the FQHCs in the state of Washington in various capacities, but predominantly working with them on their EHR systems and telehealth integration. We're also doing a lot to help support affordable broadband across the state. How we got involved in this, I think it would be helpful for everybody to hear, is that we are best known for our instance of Epic that we support for ambulatory community health centers and the public health departments. And we were working with Seattle-King County to help them build out 5 to now 10 various levels of tent sites, hospital tent sites, to help them support the overflow in the Seattle-King County area. And at the same time, the state of Washington reached out to us to collaborate around being able to partner in some of the underserved areas. Dr. Chen had reached out to us. Also, they had reached out to Epic to see if we could find a way to help support underserved communities in being able to ensure patient charting tools are being deployed should emergency tents be needed to be set up across the state. So that's how we had gotten involved in this project, to be able to kind of connect the dots and make things be bringing together both the state as well as Epic to be able to collaborate and try to create tools that quickly could be deployed and that are very, very simple. So next slide, please, Tashana.
Thanks. Thank you, Jen. And so just to kind of provide a little bit more of the background in terms of healthcare authority initiatives in the telehealth and health IT space, I see a number of provider groups, hospitals, ACHs, FQHCs on the call today. So thank you so much for joining. Just want to let you know that the Healthcare Authority is very committed to kind of supporting the delivery system changes that are needed in the time of the pandemic response. We understand that our delivery system is going through a number of unprecedented changes and really relying on telehealth. And so we've been very active in supporting that change. I will say that when I talk to my Medicaid medical director colleagues in other states, I think that we had were relatively more set up from a telehealth policy perspective in Medicaid in terms of having paid parity even before the recent Senate Bill 5385 on in-person and telemedicine visits. We allowed for a number of different sites of care, including the provider and the patient being at home, a number of different sites of service, including hospitals and clinics, et cetera. And so I think in addition to that, we've been working on additional telehealth policies that are all available on our Healthcare Authority website. And also been working on engaging providers, supporting various provider communities, especially the behavioral health provider community, and just kind of providing some more hands-on assistance and guidance in telehealth. You may have heard a little bit about our Zoom license program, which was meant as a way to support small independent practitioners with a plug-and-play telemedicine solution for them to immediately reach out with an audio-video platform to their patients. And that more information about that is available on our website as well. And the specific initiative that we'll be talking about today is this mobile platform for COVID-19 testing. Next slide.
Apologies, all there seems to be a delay.
Okay, thank you, Tashana. So I think we all kind of understand how important testing is as a means to control the pandemic, and importantly, for us to kind of ultimately reach a state where we feel that the disease is under control and society can return to normal activities or near normal. And so we also understand that traditional sites of care may not be able to shoulder all of the burden of testing. And these traditional sites of care, you know, for medical care, usually clinics, urgent care, the emergency department, or hospitals. And so understanding that there are a number of different groups out there, be it public health or collaboratives that are performing testing in non-traditional settings, such as pop-up sites. We wanted to support a mobile solution that would be able to provide some of that infrastructure for those non-traditional settings that also connected back to some of the more traditional sites of care. And so some of these potential settings might be pop-up sites, might be drive-through testing, might be shelters. And so I think that just to clarify a little bit about this, some of these other considerations for this use case, I think it's important to recognize that this platform is really probably more useful for people that don't already have parallel systems or are thinking about setting up testing sites based on a paper system that is running in parallel to their other systems. So for example, if a clinic already has an has an electronic medical record, this may not be as helpful, but kind of more for those non-traditional settings and sites of care. With that, I think it might be helpful for Jared if you want to go ahead and start sharing what the platform looks like.
Yeah, absolutely. So hello everybody, my name is Jared Zimmer. I'm part of Epic's implementation team back here in Madison, Wisconsin. A lot of the things I was going to cover in this slide, Chris already kind of hit on. I think this is going to be great for folks to reference back for some more of the specifics. But at a high level, overall, this is a mobile solution that allows us to be able to provide care, be able to get patient documentation completed in a mobile setting or in those non-traditional settings. So, like Chris mentioned, places like shelters, schools, possibly some of those tents or community centers that are popping up to make sure we're facilitating testing for the next few weeks or months. So with that, I'll jump to the next slide and I'll kind of get a little bit more into the details of how the workflow actually functions. So the two major parts of the workflow consist of patient sign up for patient registration and then the clinical documentation itself. So to get things started, we start with patient sign up or that patient registration, or a clinical volunteer or the patients themselves. That's something we can be flexible with. Sign up or sign in using a web browser. So this gives us the opportunity to allow a volunteer that's working in your testing site or is helping get people, signed up and registered as you're going to a shelter. Gives them the opportunity to use their own cell phones. Just go to Safari or whatever web browser you use on your phone and be able to access this registration. So after they go to the website, they'll be prompted to select a location. So you'll be able to say, this is the triage site or the testing site in which we're working out of, and allows them to select an appointment time. This can be used in a couple different capacities depending on your actual location. So if you're interested, we can talk about how this can particularly be used. But ultimately, you'd select the time in which the patient will be seen or put them next on the list, and you're able to continue forward. After we determine when the patient's going to be seen, we jump in and collect some of the patient information. So this is basic patient demographic information that you would see as you're registering in just about any clinic. But keeping it fairly simple: first name, last name, date of birth, your legal sex, and then a phone number and address. So fairly simple. And then the one thing to know is behind the scenes is as we're collecting this demographic information, it does do a patient match behind the scenes. So if, let's say in our situation, we have Elmer Disson, who is coming in or is being seen at our site today. If that person was already a patient in OCHIN's environment, we would be able to match that patient back up with the patient record that's already in OCHIN's environment and be able to tie the care that they've already had within OCHIN with this new testing or with this new testing encounter. If that person hasn't been seen by OCHIN, that's completely okay. We'll create a new patient and continue to move forward as needed. And then lastly, once we are able to confirm that information, confirm the time that the patient is going to be seen, we receive confirmation that the patient's good to go, and they're able to proceed into the clinical assessment area or be seated for them to be seen by a nurse or physician that's working. Second, this gets us into our clinical assessment. So this is for the clinical volunteers or the clinical folks that will be working either the testing site or as a part of a mobile testing group. And this functions again through the mobile device. So they're able to open up an application on their phone. We call it Rover. and are able to search for the patient. So they'll be able to search for Elmer once they've been registered, and we'll be able to open up their chart and jump into a COVID-19 template. So once they found that patient, they will then get into our second step and be able to document symptoms and vitals using a standard COVID-19 template. This is going to be a lot of the same questions and basic vitals that you're seeing kind of be used standardly across the country. Things like, have you had a fever? Have you taken any fever medication? Are you experiencing any shortness of breath? Do you have any comorbidities that may be at play here, like lung problems, diabetes, etc. As well as be able to take a basic set of vitals. So things like temperature, blood pressure, those types of basic things. And you're able to do all of that through the phone. So just able to click through yes, no, and be able to type in just using your standard keyboard the information for the temperature and blood pressure. So as we go through that template, we complete the documentation, and from there we're able to actually finalize the documentation or the clinical assessment by writing a progress note. So this allows you again to use free text, as you can see in the step 3 screenshot, to document whether or not our patient is seeing those symptoms and be able to provide a little bit more of a physician assessment or a clinical assessment on what the next steps for the patient is going to be. So in this case, Elmer is experiencing symptoms concerning for COVID-19, so we are going to proceed for them to get COVID-19 testing. And then from that point, we're able to sign that note. If there's any other information that pops up, so if as Elmer is sitting within a testing site, or as we're kind of rounding within a shelter or a more dynamic environment, we could re-look up Elmer, provide an update to that note, and update documentation again if needed. But for the most part, we'd go through this initial clinical assessment, and we'll be able to hand them off to the group that's actually performing the test itself. So they'd be actually collecting the specimen and putting the label on the vial, and then being able to send it off to the telehealth. And then lastly, once we've completed that basic COVID-19 template, completed a progress note just indicating our path of care. Lastly, behind the scenes, the patient information and the clinical documentation that we've collected is stored in OCHIN's instance of Epic and can be made available for use at other healthcare facilities using Epic's Care Everywhere interoperability platform. So Care Everywhere is Epic's data exchange portion of our platform that allows us to exchange information across multiple electronic healthcare record systems. For example, just within the state of Washington, we exchange over 11,000 records each month. So records are going back and forth, and is a very widely used interoperability platform, and allows us to share the information that we're documenting in these mobile settings with other organizations. So if Elmer was able to get testing today and needed to be seen, or ends up showing up at an ED or another urgent care clinic in a day or a couple weeks, they would have the opportunity to find this information and be able to see that he was seen and see the documentation that took place in this mobile test. That is the high-level overview of the workflow. And again, it's essentially boils down to patient registration using a web browser, and then the clinical assessment being completed using Rover, which is our mobile solution as well.
So we have a question, Jared. If you're an Epic client and we wanted to use this tool and have information come back to our own instance of Epic, would we need to have a Rover license to do that?
So within the COVID-19 kind of environment, we are being flexible with being able to extend the Rover license for use in COVID-19 testing. And if you are already an Epic community member, or already have your own instance of Epic, I would suggest that you reach out to your Epic BFF or technical coordinator to work out how you would be able to extend this, and to talk with them about the possibility of getting access to the Rover license in a temporary capacity. We've had some of those conversations throughout the country, so if that's something that you'd be interested in, I would encourage you to reach out to them, or if you want to reach out to me, I can help connect you.
And Brittany Free has a question. Does this work with all EHRs or is it only with Epic? I'll take that question. OCHIN, our instance is connected through all the national frameworks, eHealth Exchange, through eHealth Exchange and Care Quality. And that's where this document becomes exchanged. We're also connected to One Health Port as well. So the idea is that it'll be fully interoperable as long as you're connected to, as long as your instance of whatever EHR you operate is connected to one of those same frameworks. I'm looking for any further questions.
Great.
We'd
Yeah,
love to encourage for further questions as well. Sorry, Chris.
Yeah, go ahead. I was just going to say the same thing, Jen. I think that was a great summary of kind of the mobile platform and kind of understanding that there are a number of different considerations as different providers and hospitals have different systems in place. But wanted to open up the floor for questions if you guys have any. And feel free to type them in the group chat box as well.
Or you can unmute yourself by hitting *6. So there was a question from Cameron Anderson. If you're not an Epic client, do we pay license fee for use of this tool?
Jennifer, do you want to take that since it's being extended through OCHIN's instance? I mean, ultimately, no, this is something that we're providing in collaboration through OCHIN's instance. So I'll provide this testing.
All right. Chris will leave the chat box open for another 30 seconds or so. Do you have any final comments or thoughts?
I don't have any, yeah. If you guys have any other questions, feel free to email us yeah, happy to talk more.
So it doesn't look like there's any more chats coming through. So Tashana, I'll go ahead and pass it back to you.
Thank you everyone for attending today. As we mentioned at the start of this call, we'll be answering any, oh, it looks like there is one more question from Dan. I think I missed the name of the app to download. Can you please share again?
Yeah, so it's not an app that you'll be able to download directly from the App Store and have it work. There is some implementation that would need to take place for us to get this working. So if you are interested in using this workflow or this mobile platform that we've gone through, please reach out to Jennifer Stoll, whose email that we just showed on the screen a second ago, and we can have further conversation on how we can get this set up for your specific use case.
Great, thank you, Dr. Chen. Thank you again, everyone, for attending this webinar today. And as I mentioned earlier, this presentation will be available on the site later today, on the HCA site. And any additional questions that come through, you can send them to me via the Zoom email that you see there, or Jennifer Stoll, and that's stolljay@ochin.org. And again, it will be available on one of the last slides on the HCA website that will be uploaded after this. Thank you again, everyone, and I hope you have a great day and take care.
Thank you.
Thanks.